Okay, welcome back students. Now we will see what are the complications of fracture. Majority of fracture will heal without any complications, but some of the fracture can be some severe fractures, non-healing fractures can lead to some complications which are very life-threatening. So complications of fracture you can divide into early complications and late complications. Early complications of fractures are shock, fat embolism, compartment syndrome or Boxman contracture, deep vein thrombosis, and disseminated intravascular coagulopathy and infection. Then late complications are there or delayed complications like delayed union, non-union, avascular necrosis of bone, then reaction to internal fixation devices and joint stiffness. Okay, now we will see what are the early complications one by one, and we will see the later complications. So shock, it is one of the early complications. Mainly it will be hypovolemic shock. Okay, hypovolemic shock. How hypovolemic shock occur in fracture? Because of the blood loss. Because of the hemorrhage as a trauma, blood will be lost and it will lead to some fluid. Okay, a loss of extracellular fluid into the damaged tissues. So, what are the treatment of shock? Yes, fluid resuscitation or blood transplant or blood transfusion and fluid resuscitation. Then you can give the first aid management for bleeding or hemorrhage, okay, compressive dressing, etc. to prevent further volume loss or fluid loss. So shock is one of the early complication. So next major complication and very life-threatening complication is called compartment syndrome. So what is compartment syndrome? It is a condition in which elevated intra-compartment pressure within a confined body space. It is a condition in which elevated intra-compartmental pressure. There are different compartments. Okay, different compartments, and this compartment pressure will be elevated within a confined body space, especially in the leg or forearm. Okay, especially in the leg or forearm, or in simple definition, it is the increased pressure in the muscle compartments. Okay, pressure increase ആവുന്നതാണ് compartment syndrome എന്ന് പറയുന്നത്, and this syndrome will causes reduced capillary perfusion. Okay, capillary perfusion, it will reduce the circulation, blood circulation, which will leads to later ischemia and necrosis of the muscles and nerves. Okay, this syndrome, why it appears means commonly it arises due to some restrictive dressings, then splints or cast. Okay, then some excessive tractions, trauma, burns, all this will leads to compartment syndrome. So when compartment syndrome occurs means it develops when the tissue perfusion in muscle is less than required for tissue viability. Okay, because of the high pressure, tissue perfusion will be compromised, and patient can complain of pain, severe pain. Okay, that is the first major symptom. Okay, and it will not be relieved by any painkillers also. There are different clinical manifestations. The major clinical manifestations of compartment syndrome, it is said as P's, 6 P's. Mnemonic ആയിട്ട് പറയുന്നത് 6 P's ആണ്. 6 P's എന്താണെന്ന് ചിലർക്കൊക്കെ അറിയാം. 6 P's. P stands for pain, pulselessness, pallor, paresthesia, pressure, that is increased pressure, paralysis. Okay, and sometimes renal failure can also result. So these are the clinical features of compartment syndrome. And compartment syndrome management is only surgical decompression. That is called fasciotomy. Compartment syndrome management എന്ന് പറഞ്ഞാൽ surgical decompression ആണ്. Fasciotomy is a surgical procedure ആണ്. Fasciotomy, surgical decompression of the involved compartment. Okay, അത് detail ആയിട്ട് പഠിക്കേണ്ട. നിങ്ങൾക്ക് compartment syndrome എന്താണെന്ന് അറിഞ്ഞിരിക്കണം. Why it is, how it is occurring, and what are its clinical feature, and what is the management. And also you can elevate the affected limb to promote the to relieve the pressure also. Okay. So next one is Bowman's contracture. It is a complication of compartment syndrome, and it occurs usually in upper extremities. Okay, Bowman's contracture ഒരു കമ്പാർട്ട്മെന്റ് സിൻഡ്രത്തിന്റെ തന്നെ ഒരു കോംപ്ലിക്കേഷൻ ആണ്. അത് കമ്പാർട്ട്മെന്റ് സിൻഡ്രം അൺറിലീവ് ആവാതെ വരുമ്പോൾ ഉണ്ടാവുന്ന ഒരു കോംപ്ലിക്കേഷൻ ആണ് Bowman's ischemic contracture എന്ന് പറയും. And this is due to ischemic muscle replaced by fibrous tissue. അപ്പോൾ ഇത് എപ്പോഴാണ് സംഭവിക്കുന്നത് വെച്ചാൽ when the compartment syndrome occurs and when it is not relieved, this ischemic muscle will be replaced by fibrous tissues and it will be converting to a stiff claw-like deformities of hands and arm. ഇതൊരു deformity ആണ് Bowman's contracture എന്ന്. അപ്പോൾ ഇത് സംഭവിക്കുന്നത് compartment syndrome relieve ആവാതെ വരുമ്പോഴാണ്. ഇത് ഒരു സ്റ്റിഫായിട്ട് ഏത് ലിംബാണോ എവിടെയാണോ അഫക്റ്റഡ് ആയിരിക്കുന്നത് അത് സ്റ്റിഫായിട്ട് വരും, അതൊരു ഡിഫോമിറ്റി ആയിട്ട് വരും. ദാറ്റ് ഈസ് ഇറ്റ് cannot be used, that part cannot be used. So only the management is management of compartment syndrome. Next complication is called fat embolism syndrome. Okay, fat embolism syndrome, it is characterized by presence of fat globules from the flat globules that will be distributed into the tissues and organs after the injury. After the injury has occurred, some fat globules will be released to the blood and this will be distributed to the tissues and organs of the muscles and bones after the injury, and this will result into the death. Okay, fat embolism syndrome, it is moving into the blood because of the increased pressure. Okay, bone marrow pressure is greater than capillary pressure. It will be moves into the blood and other tissues and organs, and this usually occurs within 24 to 72 hours after the injury has occurred. So here management is only immobilization. Immobilization is only the management, and there are different features, clinical features like ARDS, acute respiratory distress syndrome, then chest pain can occur, then tachypnea, then tachycardia, dyspnea. All these will be all these symptoms, respiratory difficulties are occurring because fat globules will be transported to the lungs. Directly these fat globules which are released from the muscles, it will be distributed into the tissues and organs through blood and it will reaches the lungs and causes poor oxygen exchange. Okay, so treatment is only careful immobilization in fat embolism syndrome. It is very dangerous situation. Next, another dangerous complication is called deep vein thrombosis or pulmonary embolism or venous thromboembolism. So this complication is caused because of venous stasis or reduced blood supply or pooling of the blood, no proper blood circulation, and it may be due to because of the commonly lower extremities fractures and pelvic fractures are more susceptible to thrombus formation. The venous stasis, why it is occurring? Because of the thrombus formation, and commonly this occurs in lower extremities and pelvis, high risk for thromboembolism, and this may also leads to death because this thrombus can transport or this can go to the lungs and deposit there and it will affect the gaseous exchange. Then another complication, infection, you all know, when the fracture is not healed, especially open fractures, which are open fractures, when it is not healed, it can lead to infection. So the patient should be suspected or assess the patient for any signs of infection like redness, swelling, temperature, purulence, purulent drainage, pus formation. All these will be assessed and antibiotic therapy should be started if any signs of infection are there. Okay, so these are the some of the early complications. So we have seen what are the early complications. First one is shock, that is hypovolemic shock, then compartment syndrome, then next, what is the next complication? Shock, compartment syndrome, fat embolism, then deep vein thrombosis, Then infection, and one more symptom is complication is the disseminated intravascular coagulopathy. It is a blood disorder that you will study in hematological disorders. Okay, disseminated intravascular coagulopathy is also a bleeding and blood disorder, bleeding disorder. Now we will see delayed complications. So delayed complications are delayed union and non-union, vascular necrosis of the bone, some reaction to the internal fixation devices. So here delayed union and no union. Delayed union means what? Delayed union. I don't have the slides, just I am giving you the explanation in brief. Delayed union means it is not union, non-union of or not. Delayed union means it is prolonged union അല്ലെങ്കിൽ late union, union of bone. ഇവിടെ ഹീലിംഗ് താമസിക്കുന്നതിന്, ബോൺ ഹീലിംഗ് താമസിക്കുന്നതിന് പറയുന്നതാണ് delayed union. It is prolonged healing of bone beyond the usual time period. നോർമൽ ആയിട്ടുള്ള ഒരു ടൈം പീരീഡ് കഴിഞ്ഞിട്ടും ഹീലിംഗ് സംഭവിക്കാതിരിക്കുന്നതിനാണ് delayed union എന്ന് പറയുന്നത്. പക്ഷേ ഹീലിംഗ് സംഭവിക്കും, but it will take some time, and it may be due to some poor nutrition, inadequate immobilization, infection, or necrosis. Okay, that is called a delayed union. And then next one is non-union. What is non-union means? Bone is not uniting. Non-union, delayed union commonly leads to non-union. That is non-union, bone is not at all uniting. Bone normally union ചെയ്യും സമയം എടുത്തിട്ട്, പക്ഷേ ഇത് അതായത് ഇത് യോജിക്കില്ല, ബോൺ യോജിക്കില്ല. സോ ഇറ്റ് നീഡ്സ് എ സർജിക്കൽ ഇന്റർവെൻഷൻ, ദാറ്റ് ഈസ് കോൾഡ് നോൺ യൂണിയൻ ഓഫ് ബോൺ. സർജിക്കൽ ഇന്റർവെൻഷൻ ഇവിടെ ആവശ്യമാണ്. ഇനി അവസ്കുലർ നെക്രോസിസ് മീൻസ് വാട്ട്? അവസ്കുലർ നെക്രോസിസ് മീൻസ് വാട്ട്? ഡെത്ത്. ഓക്കെ, ബോൺ ടിഷ്യൂസ് ഡെത്ത് ആവുന്നതിനാണ് അവസ്കുലർ നെക്രോസിസ് പറയുന്നത്. ദാറ്റ് ഈസ് ഡെത്ത് ഓഫ് ദ ബോൺ ടിഷ്യൂ ആൻഡ് ഇറ്റ് ഈസ് ഡ്യൂ ടു ദ ബ്ലഡ് സപ്ലൈ. ഇനി റിയാക്ഷൻ ടു ഇന്റേണൽ ഫിക്സേഷൻ ഡിവൈസസ്. You know, some of the devices will be internally fixated during the surgery, and our body may respond to this devices. Okay, അപ്പോൾ അതിന്റെ റിയാക്ഷൻ സംഭവിക്കാം. Okay, normal response ആണ്. Some of the persons, okay, this devices will be immune response ഉണ്ടാവും, ഇത് റിയാക്ട് ചെയ്യും, അപ്പോൾ അങ്ങനെ റിയാക്ഷൻ സംഭവിക്കാം. Then joint stiffness. Okay, stiff ആവും. Okay, it is the late complication due to contractures occur. Okay, contracture occur ചെയ്യുന്നതുകൊണ്ട് സംഭവിക്കുന്നതാണ്. Joint, affected joint, later on it will become stiff. So these are the complications of fracture. So we have seen early complications and late complications. Now we will see what are the nursing management. So nursing management you can write in points. Okay, nursing management you can write the points like encouraging the patient to mobilize. Okay, not to mobilize, that is encourage the patient for immobilization. ഒരു ഫ്രാക്ചർ മാനേജ്മെന്റ് ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ള ഒരു ട്രീറ്റ്മെന്റ് എന്ന് പറയുന്നതാണ് ഇമ്മൊബിലൈസേഷൻ. ഓക്കെ, ഇമ്മൊബിലൈസേഷൻ ആ ഇമ്മൊബിലൈസേഷൻ പീരീഡിൽ നന്നായിട്ട് ഇമ്മൊബിലൈസ് ചെയ്തെങ്കിലേ ഫ്രാക്ചർ ഹീലിങ്ങിന് ഹെൽപ്പ് ചെയ്യുള്ളൂ. Then afterwards exercising. Okay, you can ask the patient to do some range of motion exercises, not heavy exercises. Some range of motion exercises can be advised. Then using assistive devices, you can teach the patients. Then assistive devices, then patientine assess ചെയ്യാൻ പറയുക, complications എന്തെങ്കിലും assess ചെയ്യാൻ പറയുക. Then about the medicines. Okay, then in care of external fixation. അപ്പം എന്തെങ്കിലും എക്സ്റ്റേണലി ഒരു ഡിവൈസസ് എന്തെങ്കിലും ഫിക്സ് ചെയ്തിട്ടുണ്ടെങ്കിൽ അത് പ്ലാസ്റ്റർ കാസ്റ്റ് ആവാം, അല്ലെങ്കിൽ എനി എക്സ്റ്റേണൽ ഡിവൈസ്, സ്പ്ലിൻസ് ആവാം, ട്രാക്ഷൻ ആവാം, അവർക്ക് ഡിവൈസ് ഫിക്സ് ചെയ്തിട്ടുണ്ടെങ്കിൽ അതിന് കെയർ ചെയ്യാൻ പറയുക. Then you can write the nursing diagnosis. You can formulate some nursing diagnosis and you can write interventions. Okay, some nursing diagnosis like acute pain, impaired physical mobility, activity intolerance, self-care deficit. All these are some of the nursing diagnosis you can formulate. Okay, thank you all. So we have seen the complications and nursing management in this presentation. If any doubt you can ask. Thank you.